Dr. Jagruti Shah, Preventive Diabetologist from Bombay. You are watching me on a Sify.com.
How does being overweight, especially at the waist, increase the odds of developing type 2 diabetes?
See, over the years, with various research and various observations, especially in my case, in my patients, I've been practicing more than 20 years and I've got 10,000 patients following with me regularly. I have found out that waist-hip ratio, that is the central obesity, is a very strong predictor of cardiovascular complications. That means by and large, even in India, I mean compared to Western population, we have found the most important cause of morbidity and mortality is cardiovascular events in diabetic patients. So it's very difficult to judge every patient very frequently, as I pointed out, going by various echocardiographies, stress testing or angiographies. Diabetic patients' lifespan is say more than 40-50 years, because even if you detect at the age of say 35-40 years, I mean you can't keep on doing in every patient's periodic such test every 3 yearly. It becomes a very expensive affair, and sometimes patients' compliance is not there. So central obesity, if you try to take and concentrate upon and keep on working on it for years together, then possibility is there that many times we don't have to subject the patient to angiography every 7 or 10 years, or stress testing every 2-3 years. Waist hip ratio in a female patients, we want it to be less than 0.8. Maximum upper limit is 8.85 to 9, and in male patient 0.9 to 1. This is the upper limit we allow. If your waist hip ratio is any time in a female more than 0.9 and in a male more than 1, then chances are there that you are likely to suffer from future heart problem. In fact, in my group of patients, I had done one very interesting study which I had presented abroad also, and that is a triglyceride upon HDL ratio. That is, if you are doing a parameter, it's a simple test, lipid profile you have to do, and TG upon HDL ratio, that has got a strong correlation with the waist hip ratio. So every patient with the abnormal waist hip ratio, if you try to correlate with TG upon HDL ratio, and if that ratio is on higher side, we call it as a atherogenic index of plasma, then your chances of developing coronary vascular events are very high. So the moment you try and correct these parameters from beginning of diabetes, that means indirectly you are not allowing the atherosclerosis happening in the major blood vessels, and that is very, very important. The other aspect of it is, I can explain more at the tissue level, that you have a different types of fat cells in our body. We have a diabetes because of two reasons, as I said. Either there is a deficiency or a reduced production of insulin in the pancreas, so we have a high blood sugar. The second is insulin is produced, but it is not effectively utilized because of insulin resistance. Now when we talk about waist hip ratio or the central obesity, it is a area where there is a highly abundant fat cells, there is a fatty acid sort of accumulation, and we have found out from various studies that these fat cells, they are responsible for insulin resistance because of they liberate various cytokinins like interleukin 6, resistin, then leptin, then tumor necrosis factor, and lot of NEFA, that is non-esterified free fatty acids, and all this together they contribute to insulin resistance. So the lesser you have this type of fat cells, the less chances of developing insulin resistance. Now various studies have recently found out that is brown adipose tissue, which is sort of present in between the scapula and other part of the abdomen. This particular tissue can be adapted, and if it is present in proper concentration, then sometimes people do not develop central obesity because they are responsible for thermoneogenesis and burning the fat. But when you have a deficiency of this brown adipose tissue, or whenever you have a malfunctioning brown adipose tissue, sometimes we have seen patients developing type 2 diabetes because of this insulin resistance which is occurring at the level of abdomen. So I have explained you in detail that how insulin resistance itself can cause abnormal blood sugar value and how it can cause various complications of diabetes.
And your takeaway message on the World Diabetes Day?
World Diabetes Day, 14th November. Usually this day celebrations are happening all over the world. I have been celebrating this World Diabetic Day for various years with my Diabetes Welfare Trust, and that is Dosti. And the message I have been giving for years together, that has been that every stage of diabetes, whether on detection, whether you are suffering from various complications of diabetes, or whether you are in a terminal stage of diabetes where you require a frequent hospitalization, at every stage there is a hope for reversibility if there is a good teamwork. And at every stage, no matter how bad the situation is, there is a hope of improvement in quality of life. And if this is sort of understood by not only the patient but patient support system, that is the all family members who are sort of trying to help the patient in come out from his bad phase, patient support system and patient's medical team, that is a team working with the patient, that is doctors and associated paramedical help. If it is understood very well, then it is very well seen that most of the patients get predictably desired results in a positive direction, where the reversibility can be seen clinically, can be seen biochemically, various parameter wise, and it can be seen in improved quality of life.